We will now examine what is healthy, what is unhealthy, and what is considered a change for each of the categories. Lips. The Oral Health Assessment tool uses 0 as a healthy indication that the lips are normal and healthy. They should be smooth, pink, and moist. There may be a slight variation of normal, but in general they look healthy. When changes occur, you will see dry, chapped, or red areas, usually at the corners of the mouth. As mentioned, in most cases the intervention required is lip lubrication with a non-petroleum-based product. Dry, cracked lips may also be a sign that a resident is dehydrated and their fluid intake may need to be increased. Monitor the resident for 7 days, and if their condition worsens, refer to an oral health care professional. Abnormal swelling, lumps, bleeding, or ulcers associated with the lips may be an indication of a more serious problem, and the resident would benefit from referral to a physician or dental professional. Tongue. A normal healthy tongue is moist and pink. A normal tongue surface is always somewhat rough with a crease down the center. Changes to the tongue can be patchy, fissured, red, and coated. These can sometimes occur if the resident is dehydrated or if they take a number of different medications that reduce their saliva flow. It is important to keep residents hydrated. If there is a film or white coating on the tongue, a tongue cleaner or toothbrush can be used to clean the tongue. Tongue cleaners or scrapers are available commercially, but a toothbrush can work just as well. Start brushing from the back of the tongue and move forward to ensure any bacteria or residue coating the tongue is moved towards the front of the mouth to be spit out, and not towards the back of the throat where it can be swallowed. A score of 2 is unhealthy, suggesting that the resident should see a dental professional. Use a gauze to hold the tongue and check along the sides, borders, back, and underneath. Patches that are red, white, swollen, or ulcerated can be more easily seen on the tongue. Oral cancers can appear on the tongue. Many cancers of the tongue go undetected, so it is important to examine all the surfaces of the tongue and note any changes. Gum and tissues. Healthy gums and tissues look pink, moist, smooth, and do not have any bleeding. When someone smiles, a healthy mouth can be recognized by how clean it looks. When checking in a resident's gum and tissues, it is important to retract the lips, tongue, and cheeks so that all surfaces of the teeth and gums can be seen. This can be aided with a tongue depressor or even the handle of a toothbrush. Changes to gums and tissues include dry, shiny, rough, red, and swollen gums. When this is noted around 1 to 6 teeth, or when ulcers and sore spots under the dentures are detected, a score of 1 is given. In the assessment tool, this area has been underlined and starred, indicating that the resident would benefit from a referral to a dental professional. Remember, any bleeding is a sign of inflammation of the gums, which is unhealthy. An in-house intervention that will resolve swollen and bleeding gums indicates more frequent or more thorough toothbrushing. Most often, bleeding gums are a sign of gingivitis. It is a result of plaque accumulating at the gum line. Regular brushing with a soft toothbrush, massaging the gum line to completely remove plaque, is the best way to address gingivitis. Signs of unhealthy gums and tissues resulting in a score of 2 and referral to a dental professional include swelling and bleeding around 7 or more teeth, loose teeth, ulcers, white patches, generalized red patches, and tenderness of the gum tissue. Saliva. If the saliva glands are secreting adequate amounts of saliva, the tissue will be moist, watery, and saliva is free-flowing. When the tissue becomes dry and sticky with little saliva present, the resident will present with dry mouth. In the case of unhealthy saliva flow, tissues become parched and red. Saliva is thick and ropey. Sometimes the tongue will appear to stick to the roof of the mouth or the cheeks. People can even have difficulty speaking when their mouth is dry. There are over 400 common medications that are known to reduce saliva flow. Since residents are often taking one or more of these medications, many suffer from dry mouth. Symptoms associated with lack of saliva include difficulty swallowing, chewing, and/or speaking. They may also have bad breath or hoarseness. Lack of saliva can lead to increased plaque formation, tooth decay, gum disease, and burning mouth syndrome. There are a number of interventions that can be considered when changes associated with dry mouth are noted. It is very important that a resident with dry mouth is well hydrated. Chewing gum and sucking on lemon lozenges are known to stimulate saliva flow. However, if these products are used, they must be sugar-free. Products with sugar can increase the risk of tooth decay. It is very important that exposure to sugar is minimal for people with dry mouth, as they do not benefit from the natural protective effects of saliva. For some people, symptoms of dry mouth can be improved with saliva substitutes, which are available commercially. Natural teeth. The category for teeth has a checkbox to note whether or not natural teeth are present. It is important to remove partial dentures when assessing natural teeth. People will often have veneers, bridges, or crowns, sometimes referred to as caps, on their natural teeth. In most cases, you can distinguish teeth that are capped by the way the light is reflected off the tooth and by its shininess. These are still natural teeth, so they should not be excluded from the assessment. Again, when doing this part of the assessment, it is important to retract the lips, tongue, and cheeks so that all surfaces of the teeth can be seen. Here you are looking for loose teeth, broken teeth, or holes in the teeth. Broken down teeth or teeth that have obvious holes or cavitations is most often a sign of tooth decay. These conditions are scored as a 1 or a 2, depending on how many teeth are affected. Residents that show signs of tooth decay would benefit from a referral to a dental professional. If there are fewer than 4 teeth present without some type of denture to replace them, the resident may not be able to chew food properly. This could impact their ability to digest food. This is also a situation that is considered unhealthy. It may require a dental professional to consider whether dentures are indicated or possible. It may also require a dietitian to be consulted to determine whether the diet needs to be modified. Dentures. Whether or not the resident has dentures should be noted on the assessment tool. Healthy dentures should be labeled and worn regularly. There should not be any broken or sharp areas on the denture. Changes to the denture can include a broken area along the edge or a broken tooth. If the resident is only wearing the dentures for 1 to 2 hours a day, this could be an indication that they are not comfortable and should be noted. It is not uncommon for dentures to get misplaced on dining trays or in washrooms. For the resident's benefit, dentures should always be labeled. This is especially important to identify when residents are being admitted to the facility. When dentures are missing or ill-fitting to the point that the resident is not wearing them, this could affect a resident's ability to eat, and proper nutrition becomes an issue. If there is more than one broken area, if the tooth surfaces are severely worn, or if the denture is missing or ill-fitting and not worn, a referral is warranted. Oral cleanliness. Oral cleanliness is very important to maintain the health of the resident's gums and teeth. Ideally, oral cleanliness means no debris, food or tartar present in the resident's mouth or on their dentures. Changes to oral cleanliness include food debris in one or more areas of the mouth or plaque and tartar on the teeth or dentures. Food or debris that does not get removed with regular brushing creates conditions in the mouth that lead to gingivitis and dental cavities. If these types of infections are allowed to progress, it can eventually affect the overall well-being of the resident. Even small amounts of food debris and tartar can cause bad breath. An intervention such as more attention to daily mouth care would be indicated in this situation. Sometimes the situation is worse, and food debris and tartar is evident in most areas of the mouth or on the denture. This suggests that the resident is at risk for infection of the gums and teeth. Large cavities in the teeth can lead to tooth abscesses and infection in the soft tissue around the mouth. Periodontal disease, when severe enough, is believed to be connected to heart disease, stroke, pneumonia, and the regulation of diabetes. It is important to brush the teeth and oral tissues at least once per day. Denture care is also an important part of a daily mouth care routine. Tartar is a hard mineralized substance that cannot be removed with brushing. Therefore, residents with widespread or severe tartar buildup on their teeth require a referral to a dental professional. Dental pain. Dental pain is perceived differently by each resident. With regard to the oral health assessment chart, if there are no behavior changes, physical signs, and or the resident doesn't complain about oral pain, there is no reason to be concerned. Sometimes there may be verbal or physical signs of pain. If a resident is not able to directly communicate that they are having mouth pain, it is important to observe them for cues. They may wince or pull away, especially when anyone attempts to examine their mouth or brush their teeth. When they have mouth or tooth pain, a resident may show signs of frustration and aggression, or they may avoid eating. These types of signs would receive a score of 1. A score of 2 is a more severe indication of pain. A resident may have more obvious physical signs of disease such as swelling, broken teeth, ulcers, or gum boils. Many residents will be able to verbalize their pain and explain their problem. Residents with dementia may respond to mouth pain with aggressive behavior. In this situation, they should be referred to a dental professional. Sometimes the frustration and aggression associated with mouth pain is not obvious. Care providers should always be aware that the mouth may be a source of unknown pain. Follow-up. The follow-up section of the annual oral health assessment form is designed to make sure that a resident is kept on an oral hygiene maintenance plan and sees an oral health professional if it was recommended. It's important to record the dates when any specific intervention is completed or dental treatment is received. A decision should also be made regarding the most appropriate time to do a repeat assessment, given the resident's particular circumstances. Sometimes there are also reasons that a resident, family member, or guardian may refuse suggested interventions or referral for treatment. This should also be noted.